You have to quickly be able to differentiate between a benign and a malignant mole. The symptoms are quite clear and you should quickly spot them, because early diagnosis can make a huge difference in the treatment. So it's one of the things that you have to spot very quickly. And to start quickly, you have to start with the alphabet. So remember ABCDE. A for asymmetry. You will see the mole that is not perfectly symmetrical, so it's not oval or round in shape, but rather branching in every direction. And this makes sense because a malignant mole will try to invade and metastasize. And as it does, it will go in every direction. And so it appears asymmetrical. B for border irregularity. Sometimes the mole itself is symmetrical, but its border is not regular. So roughly speaking, it would be symmetrical and circular in shape, but its borders would be irregular. And again, this goes back to the lesion itself trying to invade the tissues around it. Colors irregularity. And this is a sign of rapidly developing or rapidly metastasizing mole. Certain group of cells here and there will have inability to control the same pigmentation elsewhere. Larger moles with a diameter more than 0.5 centimeter. Because these moles are usually small, so if you see one that is large, it means that it's actively dividing and expanding. And finally, elevation. If the mole goes up more than it goes to the sides, this is also a bad sign, because sometimes the tissues around the mole will prevent it from expanding horizontally, and so we'll have only one way to go, and that is up and down. So if you see a mole that is going up a little bit, it means that it's going down into the skin much deeper. These are the signs and symptoms of a malignant mole. You should be able to spot them very quickly. Here is a comparison between a benign and a malignant mole. Use the link below to get access to the full Mnemonics course. In this course, we will discuss all the important high-yield topics that we see everywhere in the clinical practice. These topics are especially important for healthcare providers. We cover topics like the treatment of acute heart failure, tension pneumothorax, and other